Much, Dr. Primack, for joining us here today to talk about busting the myths around weight loss medication. So, to start off, what would you say is the impact of obesity on overall health?
Yeah, overall, obesity is one of the most chronic health concerns in the U.S. today. About 1 in 3 adults, even if we say it, 40% of adults have obesity. And if you add in overweight, it's about 70% of our society. This causes many illnesses or associated with many illnesses like type 2 diabetes, heart disease, and cancer, among others. And even losing just 5 or 10%, now more weight loss is better, but even losing 5 or 10% decreases these risks.
And so obviously it's a rising common issue, and more than 7 in 10 American adults are overweight or have obesity. So what is pretty much the myth around GLP-1 injections? And can you tell us a little bit more about that for those that don't know what it is?
Absolutely. People believe that these injections are painful, number one. The injection is a very small needle that just goes under the skin. What I tell people is if you pinch yourself just like this, this injection hurts less than that. For the most part, people really do well with self-administering the GLP-1 drugs. I think the second myth is that somehow these medications are magical. They are not. They're really excellent tools for decreasing hunger and therefore your overall calorie intake. But their effects are not in isolation. That you should combine them with a healthy lifestyle approach, including a balanced diet and regular exercise.
And you say that they will help in the long run to kind of decrease people's appetite?
Absolutely. That's what they're mostly designed for. And they do some other things. They change your insulin or make your insulin work a little bit better. They slow the emptying of the stomach down so you feel more full. But at the end of the day, they're crossing into the brain to turn off our hunger.
And how long would you say for someone should be taking these injections for to improve their overall health?
Yeah, I think that's a great question. I get asked all the time. What we should first do is help lose your weight. Stay on the drug for at least 6 to 12 months. If you're doing great, they are approved for lifetime use. You can, if you're doing better than you've ever done and you want to stay on the drug, please stay on the drug. If you're someone who says, you know what, let me try without it, your healthcare provider will work with you to wean off the drug. And then you follow your weight. If you stay within 5 pounds of your goal, stay off the drug. Absolutely. Keep eating healthy, sleeping, exercising, and so forth. If you gain even 5 pounds, just go right back on. It's very easy.
And would you say that with these injections, would you say that people get, in the long run, maybe addicted to them, or is it easy to weave off of them once they've reached their primary goal?
I would not say that everyone is addicted to these drugs. If you struggle with your weight, and that's who this is designed for, someone who's been unable to lose weight on their own and keep it off, or someone who, they lose weight, but then they gain it back, and they lose weight and they gain it back. These are tools that turn off the noise or the hunger that you have towards food, so you don't have to struggle with these weight problems any longer.
And for the him and hers, a holistic approach to weight loss, what are personalized options that are out there to help find the right treatment?
Yeah. Oh, first of all, this is not a one-size-fits-all approach. We've developed this personalized weight loss offering designed really around 2 things: affordability and effectiveness. The new offering is a GLP-1 medication. It's science-backed, it's doctor-developed, and it's available for people 100% online. We've developed an amazing app where you get connected with a healthcare provider who works with you to determine the best treatment for you, and then gives you realistic tips and tools for snacks, for meals. There's some trackers in there, including a step tracker, a protein tracker, a sleep tracker, and so forth. And then I think you didn't ask it, but I think the most important thing to take away from that is safety. We prioritize the safety for each person. We send you sterile syringes to use for this. It comes from an FDA-approved manufacturer, as well as for some states in the summer months that's hot, so they come to you on ice packs, and they're packed well to protect against anything that could happen in the mail.
And would you say, for those that maybe have never, don't know how to inject themselves with it, is it pretty easy to use step-by-step manual for them to do it themselves?
Absolutely. We created a great video where we have models showing you exactly how to inject the medicine, as well as a step-by-step process to follow. It is scary the first time, absolutely. But again, it is a very small pinch. It's just under the edge of the skin.
Okay, well, thank you so much for that information. Once again, our viewers, to find out more information about this product and where to go, they can go on which website?
Yeah, for men, go to hims.com/GLP1. And for women, go to forhers.com/GLP1.
Okay, well, thank you so much for joining us here and telling us all about this and taking the time today.
Thank you. Thanks for having me.